Welcome to the 25th session of Ruang Berbagi or Sharing Space. Ruang Berbagi is a weekly online talk show hosted by ASV or Aliansi Satu Visi to discuss various issues around sexual and reproductive health, activism, and other cross-section issues. Ruang Berbagi now is at Instagram, so you can follow at ruangberbagi_ASV to get the latest information of each session. Okay, in this 25th session, we're going to discuss how young people in several countries are tackling SRHR challenges during this COVID-19 pandemic. There are three alliances here. They are ASV, Aliansi Satu Visi, SRHR Alliance from Kenya, and also SRHR Alliance from Ghana. And the three alliances implemented intervention programs to fulfill sexual and reproductive health rights and have produced various promising practices. All of the alliances currently implemented Get Up, Speak Out program, or we call it GUSO, which focuses on comprehensive sexuality education and health services for young people. During this COVID-19 pandemic, there are a lot of challenges to provide CSE or comprehensive sexuality education and SRHR services. Due to the movement of restriction, like movement restriction, social distancing and also physical distancing, and also lack of PPE, or in Indonesia we call it APD, for health provider, and also the changing focus on health facility to directly respond to COVID-19. In this 25th session, Ruang Berbagi will discuss SRHR challenges and how young people are standing in the front row to tackle these challenges in Ghana, Kenya, and also Indonesia. Well, let me introduce you the speakers. Speakers for today are GUSO's Youth Country Coordinator. We have Irene Sio here. Hi, Irene.
Hi, good morning, everybody.
Hi, good morning.
Yeah, I'm here.
It's still morning in your time. Irene,
yeah,
you may introduce yourself.
Okay, my name is Irene Sio. I work in Ghana with the Ghana SRH Alliance for Young People as the Youth Country Coordinator.
Okay, thank you, Irene. Next, we have Judy Amina from Kenya. Judy.
Good morning, everyone.
Morning,
my name
Judy.
is Judy Amina. I'm Judy Amina, the Youth Country Coordinator from Kenya SRHR Alliance.
Okay, thank you, Judy. And from Indonesia, we have Eka Purniasiti. Hi, Eka.
Hello, good afternoon, everyone in Indonesia, and good morning from the other country. My name is Nelwa Eka Purniasiti. You can call me Eka. I am the Youth Country Coordinator of One Vision Alliance Indonesia.
Thank you, Eka. Thank you for the participants. And before we go further, I will explain the rules for the participants. So all participants must mute the microphone and also the video during the session. And this session will consist of 45 minutes of presentation and also 25 minutes of question and answers. And we're going to interactively talking, so you may also ask the question if you have. You can type your question on the chat room, or you can raise your hand so that I can allow you to speak. And the session will be recorded. For those who wants the record, or you can request the record to ASV Secretariat. You can email to the secretariat at satuvisi.org. Okay. So let's get started. Are you ready, the presenters? All right. How is it, the COVID-19 situation in your country? Maybe Irene, you can answer first. How is it?
Okay, sure. So currently what's happening now is that we have 4,700 cases, and we are, the cases are on the rise, unfortunately. So we were on lockdown for about 3 weeks. About 3 weeks ago, we were on lockdown, but then we were taken out of lockdown due to the fact that it wasn't really sustainable to keep all of us in lockdown. The government had some challenges and all that, so we came out of lockdown. And then unfortunately, since then, the cases have rather started rising. Before we got out of lockdown, we had 1,047 cases or so. But now, as of Sunday, 10th May, we have 4,700 cases. And there are 494 recoveries, and 22 people have unfortunately passed on. And so currently, even though we are out of lockdown, we still have restrictions on us. So parties are not allowed, large gatherings, conferences, workshops, etc. are not allowed. So recently, when our president made an address to the nation, which we see in the picture over there, so he made an update that in just one fish processing factory in Tema, which is where we have our major ports, our major processing factories, just one person infected 500 people with the virus. So we see that this is a situation that really needs to be paid attention to. And although that's not such a good statistic, but it means that we really need to be careful and still make sure that as young people, we implement all measures that we've been advised to implement. So currently so we're back to work, we're back to business and all that, but just that there are restrictions on large gatherings. So basically that's the situation in Ghana.
All right. Thank you, Irene. What about in Kenya?
So similar to Irene, our cases have also been rising. So far in Kenya, 32,000 people have been tested, and out of the 32, 672 have been found positive. There have been 32 deaths so far, but then we have a good number of recovery of 251 people. So at least with the number of people who are recovering, we are having hope that this is something that might be able to be contained with time. However, we are, unlike Ghana, we are under lockdown. Specifically in Nairobi County, we are not allowed to move out of the county or anyone to enter this county. And within Nairobi County itself, there are other areas or sub-counties where they are also on lockdown since the cases are high in those areas, so they're not able to move out or no one is allowed to go into those areas. Aside from that, we are also under curfew. So our times to be outside, we can't go outside that much anymore. So our time to be outside is between 5 a.m. and 7 p.m. By 7 p.m., everyone should be inside the house, and that's how we are trying to control the cases. The cases are rising at least with about a day. We could find at least 7 or 5 more new infections. And we hope that with the lockdown and many people staying indoors, that the cases won't continue rising. Yeah.
So thousands of people are infected, but also thousands of people are recovering. Thank you, Irene and Judy. Next, we go to Indonesia. What about here in Indonesia, Kaika?
Well, actually, in terms of COVID-19 statistic in Indonesia, like we already reached up to 14,000 and 265 cases. That is the data from yesterday. And actually more than 2,000 of people that infected are recovered. However, the mortality rate of Indonesia is 6.9%, is quite high actually, compared with the other country, where because of the increasing of the case at the beginning of March, so the government declares the COVID-19 as national disaster in Indonesia. So its implications was the social restriction. So we didn't use the terms of lockdown because the government's sensitive about the terms. So we used a large scale of social restriction where the social activity have to be canceled, and also the people have to prevent to be in the crowd or make a crowd that more than 10 people in one places, or have to well, actually, the people in Indonesia allowed to going out, still allowed to going out, but have to implement the procedures like wearing a mask and also not making a crowd, and also do some hygiene procedure as well. Well, actually, these social restrictions have been implemented until right now. So we are still some of the people still working from home, and also the students still study from home. So that's implication is schools are closed. I believe that almost all of the country schools are closed, and the students study from home until right now. Yeah. In terms of the economic situations, where in Indonesia, almost some of the peoples that work in informal sectors lost their jobs, and based on the statistics, nation's institutions in Indonesia, it's around 2.8 million people was lost their job because of the pandemic, and also much number of informal sectors as well. And at the beginning of the pandemic, the crisis that faced in Indonesia is the lack of the personal protective equipment. There is alat pelindung diri or APD, where the price of the mask is quite increasing dramatically. So yeah, so it's kind of like a crisis that we face in Indonesia at the beginning of the cases and the social restrictions implemented in Indonesia until right now.
Right.
Yeah.
Thanks, Kaika. So we all know that this COVID-19 pandemic affected not only social but also economic situation,
yeah.
But it can also affect SRHR situation. So how is the COVID-19 pandemic affected this our situation or SRHR situation? Maybe Irene?
Okay, I'm sure. So looking at Ghana and worldwide as well, I know that we've had a lot of challenges even before the COVID-19 pandemic started. And unfortunately now this pandemic is even making those SRHR challenges worse. So in Ghana, nearly a third of the population is made up of young people. So that means that anything that has to affect the SRHR of young people has a really serious impact on the whole country, because of the fact that there's such a large majority of us within the country. So even before COVID, we had issues such as unintended pregnancies here, unsafe abortions, inadequate access to SRHR information, and then all these challenges which were already affecting us. And then now, as a result of the pandemic, we know that there's an increased risk of sexual and gender-based violence now, intimate partner violence, because more people are having to depend on their partners. During the lockdowns, some people had to stay with their partners who may have been abusive, who actually, there are reports actually that there's been an increased risk of sexual and gender-based violence. And so this is one challenge that is rather unfortunate. And also another challenge is that the health-seeking behavior of young people has changed, because now, so during the lockdown and even now, we are advised to go to the hospital only when it's like really necessary and all that. And then young people are afraid that maybe hospitals have become hotspots for the virus. And so we tend to not really want to go to the hospital at all, because you never know if somebody with COVID has come to that facility. And then of course, you're trying as much as possible to prevent yourself from even getting COVID in the first place. And so the health-seeking behavior of young people has reduced. The number of young people who openly go to the facility has come down now, so which is affecting the essential SRHR services that young people have to access. And also there's economic stress, as Eka also mentioned, like lots of people have lost their jobs. In Ghana, so it's the same situation. So imagine a young person working in a restaurant, which has paused for a while because of the number of people who go in, and so they're trying to prevent transmissions. And so these young people, the young person, they may have lost their job. I was talking to somebody like last week. He also lost his job in a factory because of all these issues. And so the economic stress, especially on young women, may lead to higher levels of transactional sex, which was already an issue before. And so now with the economic stress, it could even be higher, and this could even lead to more levels of sexual and gender-based violence, intimate partner violence, lead to more levels of unintended pregnancies, just because of the pressure on the economy right now. And also, the last thing I'll talk about in terms of this is also the effects on the mental health of young people as well, because young people are anxious, may not have all the answers, maybe some in the more urban areas may have access to internet and phones, may be able to access some information, hopefully the right ones at all the time. But marginalized young people may not have access to this, and so may have mental health implications on them as well. So these are this is the SRHR situation currently in the country, in Ghana at the moment. Yeah.
Yeah, thank you, Irene. So it's not only affected the physical health, but also mental health for young people, right? Okay. Next we go to Judy.
Yeah, so I was listening to Irene and I can see so many similarities in our countries. In Kenya, something that is really, we've really come to notice is that gender-based violence, sexual and gender-based violence cases have actually increased. It's a crisis right now in the country. For example, recently, there was a girl who was kidnapped, and someone kept that girl in the house for almost 3 days before neighbors could find about it and intervene. So this girl was kidnapped while she was rushing home before she could beat the time for the curfew. And the person who kidnapped her was saying that they are on lockdown, he's lost his job, and therefore he needs someone to comfort him in the house, which is very wrong. So the girl was sexually assaulted for those days that she was there and wasn't able to get help until the neighbors were able to intervene. She's now being taken care of and she's been taken to a hospital. However, this is just one of the very many cases of SGBV that are happening. There have been people who are stabbing each other in the house. There are people who have been assaulting young girls, marginalized groups of people, and it's alarming and it's very unfortunate. Aside from that, there's also a lot of priority has been placed on COVID-19, trying to get to the cases and preventing more spread of the virus. Therefore, in the hospitals and many other health facilities, reproductive health is not that much of a priority as of now. And as Irene has shared on the health-seeking behaviors of young people, we see less and less of young people going to the hospital for reproductive health services. Young people who could go to youth-friendly centers that are open maybe up to past 6 p.m., they're not able to access these services anymore. So therefore, there's less people accessing commodities, reproductive health commodities, less people getting information on SRHR, getting referral services, and so on. And aside from that, there've also been a lot of fake news on COVID-19. And because of fake news, we get that people get panics. There's a lot of panicking. There's a lot of anxiety. And this affects the mental health of people, especially of young people. They most have also lost their livelihoods, so they don't know what next. And with all the cases, every time seeing on TV that it's rising, with the fake news saying that there's someone somewhere who has been found, as much as it's not true sometimes, that has been causing a lot of unrest among young people. So those are some of the consequences that have come with COVID-19. Yeah.
Yeah, thank you, Gigi. So it's been challenging before, but now it's more challenging. And what about here in Indonesia, Kak Eka?
Yeah, well, actually, we face the quite the same cases. The implications of SRHR services during this pandemic COVID. Yes, as what Judy said, that SRHR services is not a priority as a healthcare services in Indonesia as well. So that's why the healthcare right now is just prioritize the peoples that that really have to emergency situations that allow to go to the healthcare facilities. So that's why there are some changes of the methods of services, including the SRHR services, and also the change of the operational hours of the healthcare, which is decreasing. So a more shorter than before. Well, actually, basically, if we talking about the SRHR services in Indonesia, so our government have the essential reproductive health services, where that's owned by the Health Ministry of Indonesia since 2001. the term of essential mean the services have to provided by for the people in every kind of situations. But however, in this kind of pandemic, these essential reproductive health services are not become the priority. These services included the maternal and children services, contraceptive, or including family planning, and also STIs and HIV/AIDS, and also adolescent reproductive health. But four of these essential services that declared by the government as essential reproductive health services are not provided good enough because of the priority. The priority is about how to handling the COVID-19 disease. So that's why SRHR services also decreasing the access of the people in the healthcare. For instance, for the services of the maternal health services, where the healthcare not really focus on the maternal health. So the woman that get pregnant have to make appointment or online consultations to the healthcare provider, or go to the private midwives, where the private midwife have also the challenge like of the PPE. So it's kind of like a burden problem for the healthcare and also for the client itself. And also about HIV, we also face the crisis of the ARV provisions in Indonesia because of some of the country are locked down, and then the medications that we importing for the other country, for instance, from India, because of India are locked down. So the delivery of the medications are delayed. So that's why the ARV provisions was decreasing. And also about the contraceptives, the National Family Planning declared that the IUD is stocked out around 30 until 35%, and then the government recommend the people to use condoms and then to use pills as their method of contraceptions, just to ensure that the people's not going or visit to the healthcare facilities that make them more vulnerable to get infected of COVID. Yeah, and actually, in terms of the adolescents' reproductive health, since at the beginning, as what Irene also Judy said, that in Indonesia itself, the adolescents' reproductive health also is not really adequate since at the beginning. So right now, it's more low number of young people access the reproductive health services. And also about the sexual and gender-based violence services, the data trend is increasing of the domestic violence. So the people of the Indonesian people reported the case of the domestic violence is increasing. So that makes us assume that more people willingly to report their case as a domestic violence because maybe they have enough spare time to do some consultations or to access the online counseling or online service that provided by the private sector as well. But unfortunately, since there is a social restrictions, so perhaps there are some women that have to live with the peoples that abusive. So that's why the potentials of the domestic violence and also gender-based violence is increasing as well. Yeah, so One Vision Alliance also conducted some survey to the healthcare facilities. So the changes of the SRHR services in Indonesia, there are method of services. So right now, the healthcare facilities not provided services not only offline but also online. So the public health services have to provide the hotline numbers and also the online consultations to provide the services for the people, and also the operational hours changes and health service closure for temporary. For instance, like the member of Alliance One Vision Alliance members organizations in Indonesia that have clinics. Some of them were closed temporarily because of this pandemic, COVID, and lack of the PPA for the health worker. Yeah, so let's say that in Indonesia, the HR services is not quite good enough for the young people, but we can talking about the innovations next. What we can what we can do or what we have done about it.
All right. Thanks, Kaika. So from all those three countries, we have the need of the SRHR services are increasing, but because it's not the priority for all the governments right now, so we have to do something. And I know this situation is challenging for everyone around the globe, but what's your biggest challenges to provide CSE or comprehensive sexuality education and also youth-friendly services for young people? Irene?
Okay, so starting with CSE, so in terms of comprehensive sexuality education, so in Ghana, this was being delivered in school and then out of school as well on the program. Before last year, we had some challenges around CSE because there was some uproar about it, about the content and all that, which is currently being reviewed before we can proceed. But then even notwithstanding that, it means that facilitators are not able to go to the community to deliver any kind of SRHR information that we would normally do in like groups of people, because people can't really gather so much. I think there's a ban. No more than 20 people can gather, no more than 25 people can gather. So that has affected us. And also the fact that schools are closed globally has also affected our delivery of CSE, has also affected the number of young people that can have access to the appropriate SRHR information that we were delivering in school at first. So in terms of CSE, so that's the unfortunate thing that has happened. The closure of schools, the inability to meet as young people too has affected our delivery of CSE to young people. And also, as I was saying earlier about the number of SRHR services, so in terms of youth-friendly services, so now the attention of the nurses will be diverted more towards looking after COVID cases, towards preparing the facility for COVID cases, towards making sure that they have enough PPEs and all that. And so there's a high likelihood that they may not really pay attention to youth-friendly services, because even before COVID, so youth-friendly services is the advocacy agenda of the Ghana SRHR Alliance. We are working and advocating to make sure that there's more access to youth-friendly services. So if we are still advocating before that, now that the pandemic has even come, it means that there's lesser priority placed on that, which is a challenge because there'll be less young people able to access the essential services that they even need more during this time. And so the service may not be prioritized. And also another challenge I'd say would be in providing CSE even on digital platforms where we're able to provide some information as well. Although we are able to still provide information on digital platforms, there's still young people with limited access to data, ICT, etc., to phones that even may be able to even access conversations such as these, may be able to access the right information, the right SRHR information online. And so that's also a challenge, because it means that marginalized people are left out and may not be able to access the information that we have during this time. And SRHR is so important. Young people should be able to access all the information they may not be able to speak to that peer educator who was always maybe like referring them to services and all that, because maybe that peer educator went to their community more, but then now we've cut down on all these visits to their communities and all that because of the restrictions imposed on gatherings. So in terms of CSE and youth-friendly services, so those are the main challenges that we have in Ghana. Yeah.
Yep. All right. Thank you, Irene, for sharing. So we already listened the challenges from Irene. So we go to Judy.
Yeah.
Yeah.
So one of the main ways that we deliver CAC, similar to Irene, is through institutions, through schools, and out of school through outreaches. The same with youth-friendly services. We also, aside from youth-friendly facilities and health facilities in the communities we work in, we also deliver during community outreaches, community dialogues, and such forums. However, right now, it's a challenge because schools are closed. It's a challenge because the priority is on COVID-19 and not on reproductive health. It's a challenge because public gatherings are banned. So access to young people has been very difficult, especially those who actually under maybe do not own phones yet, because we are doing social media talks and that, but the ones who are not do not own phones are not able to access this kind of dialogues when we have them. Peer educators are also not able to move around and have group gatherings with their peers to give referrals on CSC or give information on CSC or referrals for youth-friendly services. And so that has also limited the interaction among young people with peer educators and facilities, and also us who are working within the communities. We've tried to curtail this, or we've tried to address this through social media, as I've mentioned, but it hasn't been very efficient. However, we still think it's a step forward, and as much as it's not as efficient as it was before COVID-19, at least we are still able to reach to a small group of young people with information and with services and referrals. So simply those are just a few of the challenges that we've gone through in delivery of CSC and YFS.
All right. Okay. What about here in Indonesia, Kaika?
Yeah. Well, actually, I believe that you already know that since at the beginning, the comprehensive sexuality education in Indonesia is not really strong enough integrated in our education system in Indonesia. So you can imagine during this pandemic, the quality of comprehensive sexual education is getting lower. Well, the comprehensive sexuality educations that we implemented in several schools, that the member of Alliance implemented the JSE in several schools, using the method of interactions, where we emphasize the direct interactions between students and also the facilitators, and also interactions among the students. And also, and that means that the quality of the comprehensive sexuality education was getting lower since this pandemic, because of the method of the JSE that we believe effective, that emphasize the interactions. Yes, we know that the technology is really, it's really good enough to facilitate us to do some sexual educations, but I also think that the direct interaction is not can be changed. Like the quality of the direct interaction is not can be changed. So I can say that the biggest challenge of implementing JSE during this pandemic is to get the same quality of implementations of sexuality educations as we say that is comprehensive, because we say that JSE, like sexual educations, not sexual informations, so it must be serious. So it still really have the strong struggle to implement the sexual education in service, and also consistency in the number of the young peoples that attend the service as well. So yeah, so the biggest challenge also the attendance of the people to attend the sexual education implementations. So yeah, so that's why we now more providing the sexual information or reproductive health information through social media or through online platform, such as this kind of application, Zoom, and then also private groups like in WhatsApp or Line, and many others. And also, because of in Indonesia there are diverse technology diverse technology accessible between one district to the other district. So I can say that the biggest challenge as well is the technology gap of the young people that live in urban and also in the rural area. And I also think that in the urban area itself, the young peoples also have a technology gap where the parents, where the situations are the parents were not work at all, so the income of the family are decreasing. So the capability to buy some mobile data also limited. So that's why I say that technology gap also become the biggest challenge, that not all of the young people have enough mobile data to access the online platform or online learning. And that's also struggling in Indonesia education system as well. Like education minister say that the variety of the accessible of the internet in Indonesia also varies, and not all of the young people in Indonesia have access on the internet and also technology. Yeah. In terms of the youth-friendly services, so the biggest challenge that we faced was the PPE provisions for the health worker. So that because of the lack of the PPE provisions, so like what I said before, that the SRHR services were not becomes the priority. So that's why mostly the services turn to online methods or online consultations or online counseling. Or even though some of young people really need to go to the healthcare, but after they arrive in the healthcare, the case is not considered as an emergency. So so they didn't get any services because of that kind of priority in the healthcare services. But actually there are some kind of initiative that conducted by the private sector and also the non-government organizations and also World Vision Alliance to tackle that kind of situations, to provide the services for the young people in terms of the SRHR services indeed, like online consultations, online counseling, and also online delivery of medications that maybe I can further explain about in the innovation section.
All right. So it's not only how we deliver the SRHR information, but also how the young people assess the technology. We have the challenge here. All right. Now, since Kak Eka already talked about the innovation, so we come to the innovation section. So how do you and other young people in the alliances are responding to these challenges, and to make sure that young people still can still assess the services and also the education? Irene?
Okay, so in terms of Ghana, what the Alliance is doing, there are a number of innovations, great innovations that have been put in place by the members of the Alliance. So first of all, we've shifted some more education onto radio than we had previously. We've started working with new partners in terms of radio to deliver SRHR information, also mixed with COVID prevention messages, of course, because that is also relevant in these times. So we've reached out to more radio stations within our GUSO implementation districts to ensure that we're able to provide more young people with information, so that even those who may not have access to internet, data, phones, that can access this and all that are still able to get some form of education. And also we have a jingle, like a short, like kind of like message playing on radio stations as well, to deliver information about COVID awareness, just like a 1 or 2 minutes short audio to deliver information about SRH awareness and COVID awareness as well. And also one of our partners also has a forum called the Young Voices Forum. So this is a forum that is held monthly, was held monthly even before this COVID situation happened. And so you see down there in the picture on the screen, where you see a background with Savannah signatures, a lady with a black veil. So what happens is that she's the host of the Young Voices Forum. So this was held monthly before COVID to provide young people with a space to address SRHR issues, to come up with a topic on SRHR that they wish to address, and then to have that platform as young people to discuss among themselves, discuss the way forward, to learn and share best practices about SRHR with each other. And so now this Young Voices Forum has been taken online. There was recently a video released last Sunday, so to show that this service will be provided on Facebook Live very soon. So that's also very good because it'll provide young people with information that they need, will provide them with the opportunity to be able to discuss with young people online about their SRHR challenges, which is even more important now than ever, because that sense of community is needed now that we have to really stay apart from each other as much as possible. So the Youth Voices Forum is something that we've put in place here. And also our partner Savannah Signatures also had the She Plus platform. So this was an online counseling platform that was in place even before COVID. So to provide SRH information, to provide referrals, to provide information about services and all that. And so now the platform is still running. The numbers have been widely advertised. It even includes a toll-free number as well. So the numbers have been widely advertised. And then also now there's also much information. There's been some information added about COVID, so that when the young person calls, is anxious, needs some information about COVID, they are also able to access it through this helpline as well. And then also, we've had some young people making short videos to advise each other to stay home as much as possible, to wear masks, and then when they are going out and then all that. And then we even see on the second picture on the left side of my screen, so pictorial, a poster that we developed just to remind young people that if they don't really need to go out, they should stay home. So which is one of our ways of also trying to encourage young people to stay at home as much as possible, because we may not have a high rate of mortality amongst us as young people, but then it's important to make sure that we don't end up becoming agents for transmitting the COVID to elderly people we live with. And so these are some of the innovations that we've had in Ghana. And also young people are also still going, share information one-on-one with their friends who do reach out for referrals, who do reach out with their questions, who do reach out for information about SRHR. So those who are able to reach out on phone always have their questions addressed by the peer educator whom they reach out to. So in terms of CSE's friendly service, in terms of SRHR, this is what we've been doing. And then also notable worth mentioning is that when the COVID situation first started, one of the young people from Savannah Signatures, one of the partners in our alliance, developed a video in the local language, Dagbani, predominant local language in Tamale, to educate his fellow young people about COVID. And so that was a really good innovation, because by then every message was like, most of the message were in English and all that. So that was a really good innovation worth mentioning. So in terms of how we're responding, so these are the innovations we put in place so far. And of course, there are other plans still underway by the partners, by the alliance, to make sure that we even still reach out to young people to address their SRHR challenges, even in times of COVID. Yeah, so that's what's happening in Ghana.
Yeah, so wow, that's good, Irene. I mean, you guys do the online counseling, you guys share information through radio, you have Young Voices Forum, and also the young people there campaign through short videos and one-on-one interaction. And I think that's a good innovation. Thank you, Irene, for sharing. Now we come to Judy. What about in Kenya, Judy?
Yeah, so in Kenya, we've also had a number of things that we've been able to do to reach out to young people. One of the things that we always do as young people working in this space is that we really try to advocate the inclusion of productive in the budget cycle, in the budget in Kenya. So we have a budget cycle whereby every county is able to at least hold public participations to get views from the people in their community and have those opinions put in the budget so they can be costed and implemented. It's Usually, every year we have consultations with young people in different counties where they are able to share what are some of the reproductive health issues they would like to be included in the budget and that can be implemented and costed for the next year. So this year, for the year 2020-2021, we haven't been able to meet physically, of course, because of the pandemic, but young people found an innovative way to still voices of the young people. So we had an online Google document and also a questionnaire that was led by Naya Kenya, whereby young people from the different counties were able to fill in some of the issues that they wish that would not be forgotten in the budget process in Kenya for 2020-2021. So all these views were collected and have been consolidated and will be submitted to the county government as a memorandum whereby they can get our views. So instead of having public participation forums, then we are able to consolidate this through online ways. And now this will be submitted to the government, and that then the young people will not have their voices miss out or missing in this budget cycle. So I think that's a very good way and a practical way that young people have been able to come together. And another thing that young people have been able to do, we've partnered with a group called Youth Advisory Council in Nairobi County. And this Youth Advisory Council works with the county government in Nairobi County. So they already have the support of the county. They have supplies that are supported by the government. And therefore, it's easier for them, since they have resources, so it's easier for them to reach out to other people in the community. So with these young people, what we've done is that we've shared with them some SRHR information, such as IEC materials and other issues and policy briefs and some commodities from the facilities that we work with. So they've been given protective gear by the government, and they are able to go to the community and give door-to-door services. So therefore, these people are not, they do not have to gather in one place and have a whole gathering, but instead the young people would go to their doors and give them the information, share with them SRHR information, share with them SRHR commodities, and also share with them sanitizers and masks and things that they would need but have not been able to access sometimes in the community due to the costs and or due to the geographical locations. So this is something that has worked out so well, and we are seeing at least more people are able to use the hotlines that we provide they are being provided for when they go to these door-to-door services. And another thing that I've seen that is also done in very many other countries is that we've done various Facebook Lives, Twitter chats, and Zoom calls with other young people, specifically speaking about SRHR issues that are still coming up and are alarming during this time, that we are able to look at SGBV cases, how to address them in this time, how to report them. We've been able to look at mental health issues, how to take care of ourselves, what to do in case of any of an anxiety attack or when you're having panics. So these are some of the issues, some of the ways that the young people have been able to get practical information on how to handle their mental health. And another thing, we've been able to share widely the hotlines of some of our partners. So therefore, the young people or anyone in the community, whenever they call these numbers, they can get support that they may need, especially when it comes to information. And if it's commodities, they are also able to get commodities delivered to them on their doorsteps if need be. So I think these are some of the things that the young people in Kenya have been able to do very well to ensure that they are still addressing the challenges in the communities due to SRHR.
Yeah. Great. That's great, Judy. Like you still do the advocacy to not so that the government not left the SRHR issues behind. All right. Kaika, what about here in Indonesia?
Yeah, I believe that all of us agree we don't have any lots of options than utilize the digital platforms, right? So it quite seems like what Judy and also Irene have been done. So the innovations that the young people initiate in Indonesia, or especially in the One Visions Alliance, is provide digital platforms for the young people to learn about sex educations or the reproductive health informations. So some of the young peoples in the organizations as a member of the alliance initiate to do some series of talks like the information sexual health information series of talk that using the applications that is Zoom and also the WhatsApp group. So the aim that we want to consistently reach our beneficiaries to provide the informations, but as what I said before, the challenge is also the technology gap and also the attendance of the participants as well. And One Vision Alliance also initiate the learning platform called Ruang Berbagi. This kind of sharing station is also our initiative to consistently provide the informations about the sexual health issues as well. That's conducted every week, and there are lots of series that also provided for the young people and by young people, where the speakers of young people as well. Yeah, for in terms of the services or SRHR services, uh, it's kind of like limited services that are provided by the young people directly. But actually we initiate the online consultations and also online counselings that also build a referral mechanism with the government institutions and also the private sector. For examples, like in Jakarta itself, our partners, even though the clinics are closed, but they still do some online counseling or online consultations, and then brings the medications through the online delivery applications. So all of the things or all of the initiative that we have done using the digital platforms, as what also Irene said. So now it depends on digital platforms, but unfortunately also because of we have limitations on the internet connections and also the affordability of the peoples to buy the mobile data as well become the challenge of us to really provide the sexual information to every young people as our beneficiaries previously. Yeah, I think that's the kind of innovations that we have been done as young people in the alliance. Quite the same like what Irene and Judy said.
Yeah. All right. Thank you, Kaika, Irene, and Judy. And for the participants, you may ask question. You can type your question on the chat room, or you can raise your hand. And while waiting for the question, I have more question for the presenters. Like, I want to know what strategy your government has taken to ensure that the SRHR education and services are still accessible. Irene, you can go first.
Okay. So in terms of the government, unfortunately, not much has been done in terms of ensuring that there's adequate access to SRHR services, information for young people during this period. But then there are still governmental agencies which are at least ensuring that there's online information shared out as well. But in terms of services, not much has happened. But then we do have some things which we expect or which we'd like as young people very much for the government to do or to implement to make sure that the SRHR situation is improved even while there's COVID, to make sure that even young people are even part of the response, even while the COVID situation is ongoing. So first of all, I'll start with, when our current president was elected, our sitting president, he made a statement that we should be citizens and not spectators. So it's something that young people of Ghana really say a lot. So I'd say that the government should see young people as citizens and not spectators. So we are part of this process. As I said earlier in the beginning, that we make up a third of the population of the country. So it means that whatever innovations are to be implemented at this time in terms of ensuring that there's adequate SRH information provision services for young people, in terms of ensuring that young people are even parts of the battle to mitigate COVID, I think that young people should be citizens and not spectators. I think that we should have that opportunity to have that active voice, to meaningfully participate in engagements and discussions from the local level, the district level, the regional, the national level. I think that young people should be seen as more active participants in this conversation. And we shouldn't just be expected to like sit back and then like let the nurses, like the doctors and all this handle this. I think we have a very important role to play in all this, to even make sure that even the spread of COVID is even mitigated as soon as possible. And then we are able to access our SRHR services in an easier manner as we did before. So I think that in terms of the government, I'll say that this is one thing that I would like them to do. And also, the president's address that he usually addresses us weekly in times of COVID. So as at the last address on Sunday, May 10th, so the president mentioned that there's going to be a soft loan scheme rolled out to support micro, small, and then medium-scale businesses. So one thing that we'd really like to call out for the government to do in these times is to support women's empowerment, even as these schemes are being rolled out. So to have a majority of the people receiving these soft loans be women, because as I was saying earlier, in terms of COVID, there's a higher risk of transactional sex when women lose their job, which has other implications, gender-based violence. There's a high risk of intimate partner violence. There's single mothers who need to take care of their kids. And also there's the issue that women's rights have not been seen as so much as a priority in the past, and it's something that we're still fighting for in Ghana. So for me, I think that one thing that really helps is that in terms of these soft loan schemes being rolled out, women should have the majority, women should be prioritized, and then make sure that they do have access to these even more than the men have access to. And also, we should also ensure as a country, at the local level, regional, national level, that there's still proper attention given to SRHR, because as I was saying, young people make up such a majority of the population that issues that affect young people in terms of SRHR at the end of the day could have higher implications even after COVID has gone. The risk of unintended pregnancies is there. It's even higher now because some young people may resort to living with their partners due to even these the effects on the economy that they've had. Maybe they've had to lose their jobs, they moved in with their partner for the sake of sustenance and all that. So I think that proper attention still needs to be given to our needs in terms of this. In terms of marginalized young people, I think that we need to have more innovations, more government institutions at the local level reaching out to young people who are marginalized to make sure that their needs are still met and addressed even in these times of COVID. So we should make more efforts to also publicize the fact that our services are still available, or publicize ways by which young people can still access the services that they need, even in terms of COVID. Maybe ensure young people are able to come to the facility, ensure that they still have the services, essential services that they need provided, and then find ways to do this even in times in which we are fighting the COVID pandemic. And so I think that basically that's what we'd like. And then also in Ghana, this is an election year. Now, because of the situation, we don't know what's going to happen with the election though, but I still think that even going forward, young people should be given more space in the governments, even as we are heading to the election year at the local, regional, national level, that young people should still have opportunities to be able to vie for these positions, to be able to be part of the government, so that at the end of the day, the views of us as young people are taken into consideration, and then we're able to make sure that there's better SRHR for young people in Ghana, there's better livelihood for young people in Ghana. So in terms of Ghana, this is what this is what the government has done so far, not so much, but then this is what we are calling for the government to do. Yeah, thank you.
Yeah, thank you, Irene. We have somebody raising here, but I think Judy should answer it first. Judy and Kaika should answer it first, and then we will allow George to talk. All right, Judy, what about in Kenya?
Okay, so apart from the government putting down restrictions and restrictions in social distancing and lockdowns to restrict or to prevent more spread of the virus, we've seen them at least also give us support, like for example, with the young people going to door in the communities. That is supported by also the county government of Nairobi County. And another thing is that the government, the Ministry of Health, has actually come up with reproductive health, maternal, newborn, and family planning care guidelines for continuity of services during this period. So, however, as much as this has been developed, I think maybe the government still has a long way to go in the inclusion of young people. This was developed by very minimal engagement of young people since it was very fast because of the pandemic. However, there's still opportunity to follow up with these guidelines in its implementation. So implementing the guidelines will mean that we need to have more young people that are present, that will need more voices of young people in this implementation, so that young mothers, especially teenage mothers, young mothers, marginalized group of women, adolescents, and women who are starting to use also family planning, as this is a family planning care also guideline, are not left behind. There's still a long way to go for the young people to ensure that this implementation does not marginalize young people, since it's already been branded family care, meaning that sometimes a young person might go for these services and they might be told that because of the pandemic, it's not very useful for them. So we'll need for the voices of young people to continue during this time in the implementation of these guidelines, and the support of the government in addressing COVID-19, so that young people are not marginalized and their voices are not left behind. Yeah.
Yeah. Okay. Thank you, Judy. Kaika?
Yeah. Well, actually, in terms of the health services, including also SRHR services in Indonesia, the government began to release the telemedicine procedure, so that enable health worker to the online diagnostic and also medical prescriptions for the clients. Well, this method actually was initiated by the private sector previously, but now endorsed by the government, that also encourage around 24 medical applications and online delivery services, is to ensure that the people have the services, including SRHR services, as good as usual as well. And also in terms of the SGPV services, the Women Empowerment and also Child Protection Ministry also released the hotline number, like emergency number 119, with extensions in 8 for psychological consultations and also counseling for Indonesian people who feel struggling about their own psychological condition and also feel depressed or stressed because of this kind of conditions where people lost their job and also unstable economic status, maybe lead to the depressions or stress, and also feel lonely, also lead to to the stress or depression. So that's why the ministry initiate to provide the hotline services for the people in Indonesia. That's free, free access. Even though there is an online counseling or online consultations, in the procedure also the clients that need to conduct face-to-face consultations or legal aid to tackle the problems of the SGPV. The procedure also enable the clients to get the direct legal aid with the really restrict procedure that's in the guideline. But also there is an opportunity to follow up the implementations of these kind of guidelines that being implemented in Indonesia, because it's quite a new guidelines. But I observed that there are lots of initiatives that have been done by the private sectors or non-government organizations, including the member of the One Vision Alliance, also to provide the online counseling and online consultations about the SRHR, but more of the cases about the psychological issues, because of this pandemic is not only affect the physical and also psychological, that also lead to the physical conditions of the body as well. In terms of the HSA provisions or comprehensive sexuality provisions, there is nothing have done because our education ministry also still struggling on build the strong education systems in the online learning platform, that also struggling for the young people or for the students itself. And then all of the responsibility of provide the sexual health or reproductive health information is not really fulfilled enough by the government, and the initiative take more by the non-government organizations or the private sectors through social media or through digital platform as well. Yeah, so that's all of the Indonesian government, I think, have been done for fulfill the SRHR services, and also nothing to do with the SRHR educations for the young people. So yeah, so I think that's the initiative from the Indonesian government.
All right. So George, I will unmute you so you can ask directly.
Hello, everyone. Asimo George. I work as a communications officer with Rural Aid Foundation, Uganda. We work mostly with rural areas, refugee groups, vulnerable people in rural areas. As so far, the COVID-19 crisis has caused a lot of challenges that has made us fail us exhibit our work. Right now here in Uganda, even though the government has intervened in the situation, but sexual reproductive health is still a problem, because the Ministry of Health has more of concentrated on COVID-19 and rather concentrating on issues related with women and problems in such lines. So some of the problems are that we are finding a problem whereby government is giving in resources, but local council committees, as they are providing resources to the local people, some of them do bringing in exchange for sex to give in the goods, to give in the support that has been provided by the government. So those are the things that I've found out during exhibiting my work. And then also I would like also to inquire to know some of the measures, if there are other people doing similar work like the one we are doing, because our work is directly based on interacting with those people, the refugees, local people, the rural people. So I'm inquiring of which measures are they using to interact with them, because right now we are finding hardship in reaching every person in the rural or refugee camps, because we are not allowed to access them, and yet they need our attention and services that we do render to them, but we can't do it because of the lockdowns that are put. So some of the times, actually most of the times, I do move on foot for around 40 to 45 kilometers each day to reach those areas, but under maximum restriction. So I'm inquiring of means how different organizations are doing it. If we could also get in touch with them and advise us on how to do it, or how are they doing it, if they're doing similar work like ours, and then also if there are some other partners that could partner with us or giving a hand in helping the refugees, because Uganda right now is one of the countries that are hosting the highest number of refugees around the world. So we host refugees from Congo, we host refugees from Rwanda, South Sudan. So those are the areas those are the people we are helping, but then we are finding hardships in helping them because of this COVID-19, more especially young children, women. Right now, there are many pregnant women because of restricted movement and using motorcycles. Cars are not moving. I found cases of over 9 women who are expecting to give birth in around 3 weeks, but for the previous 2 weeks, they've not received antenatal care services, and they are not sure of how they are going to give birth during that period. And some of them have had miscarriages because of not receiving medicine in time, as a result of malaria, because right now it's a rainy season. There are high levels of mosquitoes, so cases of malaria fever are high. So women actually, when I was finding out, I got 3 cases of women who had miscarriages because of malaria. So we would have come in to rescue as early as possible as Rural Aid Foundation, but because of restricted movement, limited support as of now, because some of the staff cannot move in the areas, is me and 2 other colleagues of mine who can move. So we find hardships in the movement to access every areas that need to be accessed, that comprise of those refugees who have women and other people who need our resources. So I'm requesting or inquiring if there are any advices on how to restructure our work. I welcome your views on that. Thank you so much. Yeah, Asimo George from Rural Aid Foundation, Uganda. Yes.
Right. Thank you, George. So yeah, we face it all. Like we have the difficulties to reach the people in rural or also the refugees, and it's getting worse because you guys the rainy seasons, because of the rainy seasons, and also there are many mosquitoes, like there are many people infected malaria and so on. So who gonna talk first? Irene, Judy, or Kaika? Want to respond to
Yeah, so I can go first. I can share what we're doing here, and also maybe some guidelines that could also help to improve the response to the rural women in Uganda as well. So currently, so we have the She Plus platform, which is a helpline I mentioned, which is running recently. So in terms of referrals, young people are still able to call to access referrals. We actually have a toll-free number on that as well. So I think that could be one measure at least, because if the person calls, they get some reassurance that if they go to the facilities, they could still have access to the services that they need, maybe also work, because we already had partner facilities before COVID. So this is the time that we are even going to strengthen the relationships with our partner facilities, which could also increase the likelihood of women getting better care there. So then we continue to remind them that COVID is important and a situation that we need to deal with, but then the health of women is also a priority. So we strengthen our relationships, our ties, which we are doing also in Ghana at this moment with our partner facilities. And also we are delivering information through mosques and churches. So some mosques and churches, the mosques have these loudspeakers. They have these speakers which we use for calls to prayer. And so we have also, some of our partners have also delivered information about COVID awareness through that. So that could be one way to reach out to the rural community. So you could play the message that, oh, feel free to go to the health center, or these are our partners. We have spoken to them. They'll be able to provide you that information you need in terms of maternal care, in terms of SRHR services. Then you can what's it called? You can call out a number through these mosque loudspeakers and things for young people and women to be able to access services. And then also we have peer educators who are within the community who speak the local language. We have peer educators who work in school who speak like mainly English and all, but then we also have peer educators in the community who speak the local language. So these could also be a way to reach out to these women. They could also be updated that these peer educators are available to speak to them, to provide them with referral services when they need it. And then also another way could be radio. So we are using radio currently to reach out to young people who are marginalized. So another way I think to reach out to these women and young people would be through radio. So to continue to share the information, to continue to share the information they need to take good care of themselves, especially in these times, and information about facilities where they can access services, safe services during these times. Yeah. So in terms of Ghana, that's what I'd say.
Yep. All right. Judy, do you want to add something, or Kaika?
Maybe I can add just one more thing. From what has worked with us, I think something else that could be done is a collaboration with the government. We've done that only in Nairobi County, but so far we are also going to collaborate with county governments from the different counties in Kenya where GUSO is being implemented. It's not always that we might find goodwill, but at times we may get government officials and policymakers who are very open to the ideas and the strategies that you want to implement. So trying that out could actually help.
Yep. All right. Thank you, Judy. Kaika, you want to add something?
Well, actually, I have quite same perspective as what Irene and also Judy said. And also in the rural context. In the rural context, I think the emphasis is about the community leader engagement for implementing the HR informations and also services. And before we talking about the SRHR, it's also important to think about the basic needs of the rural people that will have lack of PPE, for example, because of this pandemic. COVID is not really it's not really only infected the people that live in the urban, also have a potential to infect it in the rural. So I can suggest that that we also have to think about the basic needs of the people in the rural area, that maybe like providing the basic needs like PPE or kind of like a daily needs of the people, because of this pandemic also impacted their income most probably. And like what I can share in Indonesia right now, the social aid initiative was really huge enough, where at the beginning the government declared that have a limited budget for fulfill the PPE provisions for the people. So the community or the people, the celebrity, the influencer coming together to make some crowdfunding to really support the people's underprivileged peoples to access the PPE and also to access the daily needs for life. So I think that's also the important point that need to address for the rural people, where their basic needs also have to be ensured fulfilled to continue their life. Yeah.
Okay, thank you. I think that's quite good answers. And we're going to the question on the chat room. We have Sabina Puspita. Hi, Irene. Going back on your explanation about language disparities, I'm interested in knowing how much does language differences play a role in the inequality of young people's access to knowledge of SRHR. Do you see a pattern? Thank you. Okay, Irene?
Okay. Thanks, Sabrina. So in Ghana, so on the GOSO program, what we've done is train both in-school and out-of-school peer educators. So we have in-school peer educators speaking English when they go to school. We have out-of-school peer educators meeting with their CSE groups in the community and then speaking the local language or delivering CS in the local language. So I'd say that this is one way by which we've tried to mitigate language barriers, because if the person needs a referral, they can reach out to the peer educator in their own language and then be able to express themselves well. The peer educator will be able to express because they are speaking the same local language. And so I think that this is one way by which we've tried to mitigate this as well. So yeah, that's what I'd say. So the language barrier is mitigated by the fact that we have the out-of-school peer educators speaking the local language to young people as well. Yeah.
All right. Judy, do you want to add something? Okay. We go to Karen. Hi, thank you for the sharing. I want to ask a question for all speakers. Since the condition is pretty similar, do you think the innovations will still be conducted after COVID ended? And also, how do you conduct advocacy in time like this? Thanks. Oh yeah, Judy. Okay.
Yeah. So if there's something that the pandemic has actually shown us, it's the fact that there's that we can also address the recharge issues. For example, having digital platforms and using social media and radio for the case of Irene, and peer educators and online counseling for the different countries. I think that is something that will be able to continue even after COVID, because this has not only been a best practice that we've been able to do now, but it's also a lesson learned for us. That aside from also just physical interaction and gatherings, that there are so many other ways that we are able to reach out to young people and reach out to communities through other ways, and that these ways are actually working. And another thing in the case of advocacy, for example, for us, I can give the example of the budget advocacy that I just give. Having young people come together, we've always been challenging the budgets of the country and having reproductive health included in the budgets. But the fact that the pandemic had actually put us on lockdown and we were not able to conduct this did not prevent the young people to still conduct the advocacy. Young people still were able to come together and collected their voices through digital platforms, and it was still shared with the county governments. So that is one of the ways that we've been able to do advocacy. And aside from that, online advocacy has actually shown positive results in the past and even now. Cases on sexual and gender-based violence, as much as we're also still trying to find more ways to tackle it. There's more reporting and there's more spotlight on social media. This is because we are able to share with people, we are able to share with policymakers on social media on what we'll need them to do and support people on sexual and gender-based violence. So this has given spotlight and it's given at least prominence to this, and therefore we can see policymakers trying to address it. We can see different ways that the government are also trying to address reproductive health challenges. So with online platforms, we are still able to do advocacy, and these innovations will definitely continue even after COVID-19. Yeah.
Yep. Right. What about you, Irene?
Yeah. So I think that, as Judy said, COVID-19 has taught us a lot of lessons, and that there are still some things that are able to run, and there are still some ways by which we are able to reach out to young people, which I'm sure will be building up on and strengthening even after COVID leaves. So such as the online counseling platforms, which we've made more public now, so that young people can still access information. So this is a very good initiative that we're going to still continue to run even after COVID continues to strengthen further, because the young people know that they have an anonymous person talk to, a person that they can have that trust in, know that they can get the referral, they can get the services or get the information that they need. And so I think that online platforms will still be able to run. And then also the good thing is that they're toll-free, the online counseling. So this will also at least help for young people to be able to reach out for the information that they need. And in terms of advocacy, so I'd say that online advocacy can also be done as well during these periods. I think about 3 weeks ago, one of our partners hosted a chat on SRH and COVID, where we spoke about the implications of COVID for SRH of young people. We spoke about the challenges we are having to deal with daily. And then we spoke about what we want the governments to do as well, even for young people in terms of SRH and COVID. And so while we're doing this chats, we tagged the relevant government industries, the relevant radio stations. And then that evening, a very prominent radio station in Ghana, City FM, they carried our snapshots and then some parts of our chats onto their evening broadcast. So that means that our voices really got out there because we actually trended with that chat. So if we have more young people in there ready to contribute, we trended in that chat. So government and then the wider public was able to hear our views as young people and then our SRH concerns because of the fact that we were so many in there. And then so as this public radio station carried it out, it's also a means to reach out to the government. So I think that this is one of the innovations that we could put in place to ensure that we still advocate for our needs, even in these times of COVID. Yeah, thank you.
Thank you, Irene. Kaika, you want to add something?
Yeah, well, actually, all of the concerns already mentioned by Irene and Judy, but I just want to emphasize that in terms of the sexual educations, where we need to deliver the sexual educations in service that are really comprehensive with the methods of the direct interactions. So I think the form of the sexual educations in online is not really possible to continue because we still need the direct interactions. So the initiative that probably can be continued after COVID is sexual health information provisions and also online counseling and consultations. Yeah, and the other case, the advocacy. Yes, some of our advocacy activities are delayed because of this pandemic COVID, and then most of the stakeholders are focused on the COVID-19 as well. So that's why we have to maintain their mood as well. It's not really to disturb the stakeholders. Disturb the stakeholders kind of like mood conditions. So that's why we have to reschedule the timeline of the advocacy and also really do innovations to do online advocacy as well, because we plan to continue to write a kind of academic paper just to submit to the government through email. And also some of our stakeholders, we also keep in touch with our stakeholders through the digital platform as well. So that's kind of the digital advocacy or online advocacy also we have done through this pandemic. Yeah, even though the advocacy activity are delayed, so we change the methods of the advocacy and still continue the plan with the different method. Yeah.
Okay, and I think we have one more. Someone raised hand, so I will unmute. Okay, Faith, you may ask your question.
Thank you so much, everyone, for the wonderful presentations. And I like the idea of young people discussing because I can see various views and a lot of similarities in the countries that we are in. So specifically, my question would be, you asked about innovations that are happening to ensure that young people access sexual reproductive health and rights in this lockdown. So the discussion is focusing a lot on online and tweet chats, and which is a very good platform that we are personally using in Uganda with the young people we conduct. So I'm wondering, what about the young people in the communities that do not access internet, or they do not even have cell phones, they do not have TVs. So they are those vulnerable young people. And if you also look at the young people living with disabilities, it is a double tragedy for them. They can't access information, they can't access contraceptives, they can't move like the other young people. So it's really a question that I think maybe I would learn from the different countries how they're doing But as far as Uganda, we're trying to see how we engage them and all that. But I want to learn from everyone. How best are you reaching young people that are not so lucky enough to have internet and to have phones, or to be able to reach out to them? Like, how are you doing it? The fact that we're in lockdown and there is limited movement. Thank you so much. Otherwise, I love the discussion. And yeah, sorry I was a bit late because I was in another meeting.
It's okay. Thank you, Faith. Who wants to answer first? Irene? Okay.
Okay. So in terms of innovation in these times, so I think that what we've been trying to do mostly is working with the radio stations, partnering with more radio stations than we're partnering with previously, to at least make sure that marginalized young people still have access to some information, so that hopefully, even if they are not able to access information on online platforms such as these, they are still able to access information about SRHR, still able to join in discussions about SRHR via radio stations. And also, we have peer educators in the community, as I mentioned. So after the talks, we publicize the numbers of the peer educators as well, so that this could also be a way by which young people could reach out for information, for more information, for more referrals, and even to know the partner facilities that we have providing service in the communities. So this is one way we've been doing that could also be applied in similar countries as well. And also, we did relay some information about COVID at the mosques using the loudspeaker of the mosques. Maybe if there's already partnership with some religious faith-based institutions in the countries, this could be another way by which we could reach out to young people at the communities, because at least whatever happens, we know that there is some religious institution at the community. So if we have partnerships with them, or even if this may be the time to strike out new partnerships with them, we could look at doing that so as to ensure that we don't leave anybody behind. And another innovation that our partners have also been speaking about putting in place is the use of mobile vans to spread information, because these would also be going out in the community, and then have the loudspeakers on them share information with young people as well. So I'll say that these are some innovations that could help us to reach out to young people during these times. Thanks.
Thanks, Irene. Judy, you want to add something?
Well, I think Irene has covered most of it, but I think that's a challenge that we are also trying to get into what we might be able to do. And one of the things that I think are working is actually having the very few peer educators who actually are able to protect themselves, engage with these people in the community on one-on-one basis, but not having group gatherings. I think I also agree with most of what Irina said has covered what I will be able to also recommend.
All right. Thank you, Judy. Kaika?
Yeah, since in terms of the experience, since me myself as a personnel and also the alliance not really have kind of same situations like in Uganda, because in Indonesia, maybe the peoples in the rural still already have a cell phone, or maybe the internet connections is limited, but I just can give some recommendations. Maybe if there is no lockdown in Uganda, or the people are allowed to go out to the community, first thing first, have to ensure that the peer educator and also the peer facilitator have complete PPE, just to ensure that not really become a healthy carrier of the virus itself. So if we have to use the conventional method just because we have no options, I just can recommend that we have to ensure that the educator and also peer facilitator have a complete PPE, just to ensure that it's not really spread the viruses to the peoples that live in the other area.
All right. Yeah. Thank you, Kaika. Unfortunately, the time will be run out. So I have the last question for all the speakers, and maybe you can answer directly to your closing statement. Like, what's your expectation for the government to do more in terms of SRHR fulfillment for young people during and after this situation? And for Judy, I think you may add something about youth advisory committees, because somebody asking about that. How your different youth advisory committees are being empowered to remain meaningful amidst COVID-19 pandemic. Okay, directed to the closing statement. Thank you. Irene, you can go first.
Okay. So in terms of the government, what we want the government to do, as we were saying earlier, is that we young people expect to be treated as citizens and not spectators. So our voices should very much matter, even in this at the local, regional, district, national levels. Young people should have more of this space given to share our opinions, share our views about how the situation can even be mitigated quicker, about how our SRHR needs could be better addressed even during this pandemic. So in terms of the government, what I'd say is that they should continue to ensure meaningful participation, continue to ensure that young people's voices are heard. Because as I said in the beginning, we make up a third of the population of the country, and that's a very significant percentage of the population of the country. And well, in terms of the youth advisory body in Ghana, so we are also making, we also have constant communication with the youth advisory body through myself, because I lead the body, and also through the youth advisory body, we are reaching out to more young people in our networks as well, in the different partner organizations. So we are rallying together, sharing information, sharing best practices to help each other, even during these times of COVID. And in terms of closing remarks, I'd say that let's continue to share and then learn amongst each other. Today, I've learned new innovations from other countries, and in as much as possible as we can join online conversations, even when we can't, even if we can spread the news to young people in our rural communities, we could continue to do this as much as possible, so that together we can even ensure that our SRHR needs are met in these times of COVID. And then also the last thing is that COVID is real. It's unfortunate that it's rising in our countries. And so as young people, we have a really relevant role to play. We may think that the mortality rate amongst us is low, so we can do what we want, but let's protect the elderly ones around us. Let's protect our families. Let's wear our masks when going out. Let's sanitize, let's hand wash, and all the other measures put in place. So that's what I'd say. Yeah, thank you. And thank you so much for sometimes for young people to have access to mobile data and all that, and yet you still made time to come even during these times. So thank you so much for this panel and for being our guest today. Yeah.
Thank you, Irene. We go to Judy.
Okay, thank you. And I think for us, our young people, we call it the Youth Council. So the Youth Council has been part and parcel of all these innovations that we've been doing in the country. For example, with the budget making process, the Youth Council were also part of inputting the ideas and sharing these documents to other young people around them. For the ones who are going to the community, the Youth Council was able to also work or share information with the advisory committee for Nairobi County. And so they're also part of the consultations. On social media, they take up most of it. They're able to share their views. We are able to at least hold Twitchers together in their own organizations and as an alliance. So for us, I can say the Youth Council has been able to step up, and we've been able to see them do more things during this time. And I think for me, as maybe a parting shot or a closing remark, is that I'm very glad that young people are actually showing, they are participating and they are showing the innovations during this time. It's very commendable that young people are able to come out at large and share information on social media and give correct information. As much as there's a lot of information that is not correct that is also being shared. It's very refreshing to see young people still take part in advocacy, even during the pandemic. pandemic, as much as they are still at home and not able to do so much as they were able to do. I would encourage young people to ensure they're included in the issues that the countries are doing to address the pandemic, but so much so in addressing SRHR. For example, in Kenya, with that guideline on reproductive health and maternal and newborn guidelines for continuity of reproductive health in the country right now, it's an opportunity that young people can also take up to ensure that our voices are not forgotten and that we are part of the target group for this kind of guidelines. I would also encourage people to be very sensitive with the information that they share with other people, because we've seen a lot of panic and anxiety during this time because of fake news and rumors. Then we should be keepers of each other and keepers of ourselves, and therefore share information that is accurate, information that is correct, and that is from a reliable source. Other than that, I also want to thank you so much for being part of this and listening to us, and also sharing some of your ideas and the things that you're already doing in your countries. Thank you.
Thank you, Judy. Thank you very much. Kaika?
Yeah, so I just have a brief expectations to our lovely Indonesian government. Well, since the SRHR issue is not really become the priority of the government policy right now, so I do really hope that our government aware about the potential problems that related to the SRHR issues. So yeah, so maybe I hope that the government aware that this is the time for us to really prepare and to really take this SRHR issue seriously. So yeah, so that's why the government have to do some reflections just to strengthen the provisions of the SRHR services and also sex educations for the young people. In terms of the sexual educations, so this is the time where parents, young people as children really have very much time to live together in a house. So I think this is like a good opportunity for the governments to give information about the reproductive health and also sexual health to the parents as well, just to really explain that the importance of these issues to talking about in the family. Yeah, and also I also have the expectations for us as young people itself that let's emphasize the positive information shared to our social media, because there are a lot of hoax and negative informations through the online newspapers and also social media. So it's time for us to contribute to spread the positive information regarding to the SRHR issues, and also cheer up one to another in psychological context. Yeah. And also thank you very much for the participants from Indonesia and from the other country as well. And I do hope that we are stay safe, healthy, and also happy wherever we are.
Thank you very much, Kaika. Okay, everyone. So that's all for today. I will close this session with the quotation by Kaika. Kaika said that we have to share the positive information through our social media so that people can think twice to trust the fake news in this uncertain time. All right, thank you very much to all the speakers, to all the great speakers today, and thank you for the participants for all over the world. And don't forget to join the next Ruang Berbagi session. You can see on the Instagram at ruangberbagi_ASV to see what's next. Okay, thank you very much. Stay healthy and stay safe and stay happy. Bye.